Okay.
I'm joined by Dr. Jennifer Alverson. She's a local optometrist, and she's here to talk about the importance of eye health and what we can do to keep our eyes safe and healthy. Good morning, Dr. Alverson.
Good morning. How are you today?
I'm doing well. Thank you for joining us.
Thank you for having me.
Dr. Alverson, tell us, why are eye exams so important?
Well, for children, we have to remember that we are not born with good vision. We have to learn good vision, and we can't do that if we don't have pristine focus. So we want to, give children every advantage in life starting out. So regular eye exams for children are definitely necessary. For adults, our world is visual. We have to have good vision to succeed in life and to just enjoy life. And also we have to consider the health issues of eye exams.
And speaking of eye exams, for those who may have never had one, tell us, what tasks can an individual expect if they scheduled an appointment?
Well, an eye exam consists of two parts. One, of course, we're assessing the vision, making sure the eye muscles and the eyes focus together, that the eye muscles move together. We're assessing that the patient can attain 20/20 vision and do that binocularly. So again, eyes working together so that they can judge depth perception and that sort of thing. The second part of an eye exam is always related to eye health. We want to make sure that we are screening for glaucoma, cataracts, any systemic issues that can affect the eyes, like diabetes, high blood pressure, these types of things.
So just like we schedule appointments to have our car serviced, or even the dentist having dental exams, we too should include eye exams.
Absolutely. And a good baseline reading, even if you're healthy and normal, is always excellent so that the doctor has that to compare back to later.
Okay, and they only know what you tell them.
Exactly.
Okay. And what are some of the most common causes of eye injuries?
Most of the time it's lack of safety eyewear. Doing activities that are hazardous, such as yard work, woodworking, construction around the home. These are the most common types of eye injuries that I see.
Okay, and let's talk about signs and symptoms that indicate a medical emergency.
Well, obviously an eye injury, as we mentioned, and do see an eye care professional. Emergency rooms do their best, but they truly do not have the equipment to assess and treat most eye injuries. And many times you go to the ER and they say, go see your eye doctor. So start with the eye doctor first. Most of us do have on-call after-hours care. Other injuries, other issues that are emergencies. Number one, sudden loss of vision. If you wake up and you have, one eye seeing perfectly, the other eye is dark or not seeing well, that constitutes an emergency. Flashes and floaters, which we all sometimes think are normal, can be indicative of retinal disease or retinal damage. So if flashes and floaters that are just minor and are quick, go away, you only see them for a moment, that's typical aging. But if it's the flashes are more like a strobe, or the floaters are more like a swarm, or you have a dark spot in your vision that does not go away, this constitutes retinal damage and must be checked immediately.
Okay, and this question is for Ben. What about nutrition for healthy eyes? What can we do to help?
Well, number one, we used to think it was carrots. That's not true. That's not true. It is actually dark green leafy vegetables. So if you like spinach, you like kale, you like broccoli, eat as much as you can of that. If you have a concern in your family, because such diseases like macular degeneration can be quite hereditary, if you have that concern in your family, then good multivitamins that are specifically formulated for the eyes that contain lutein and zeaxanthin, these are quite protective.
Okay, and while a large majority of our workforce work in an industrial environment and they're required to wear safety apparel to include eye protection, there are some who work in an office environment and they use smartphones and other electronic devices, computers. What about this digital eye strain? Talk to us about it.
Well, number one, obviously if you're focused at one plane, day in, day out, hours upon hours, you can get strain, just by having that focus. And number two, when we are focused and concentrating such like that, we do not blink as much, so we get dry eye issues with that. But just take breaks from your computer screen. Another thing that is a new field of study is the blue light exposure that you have when you're looking at these screens day in, day out, hour after hour. And we know that blue light is really close on the spectrum to ultraviolet light, which, as we all know, is damaging. So we're learning about that, we're studying that, and many screens have settings where you can diminish the blue light, and also there are eyewear coatings and eyewear materials that diminish that blue light that can enter the eye.
Okay. And as we grow older, is there any advice, anything that we can do to help prevent our vision from changing?
You cannot prevent your vision from changing. No, it's pre-programmed genetics. It's why I have a job. Okay, vision changes. But basically, to maintain that eye health and to be certain that you have the most pristine focus you can possibly have is simply do not skip your eye exams.
Okay. And you mentioned earlier about some of the diseases, hypertension, diabetes. How can they affect our eye health?
Well, they can significantly damage the retina. Think about the retina like the film of a camera. So if your retina is damaged and cannot absorb light, then you're not going to get a picture. So you have to think about the effects that diabetes has on the entire systemic body. It does affect the blood vessels. The blood vessels in the eye are very fragile, and if those begin to leak and bleed, things such as diabetic retinopathy, macular degeneration, these things can actually lead to vision loss. High blood pressure can make the optic nerve swell. Carotid artery disease can allow a plaque to be expelled from the larger plaque in the carotid and end up in the eye. And obviously, if you have a occluded blood vessel, that part of the retina that is not getting blood supply cannot function. So again, you'll have a dark spot, a dark area in your vision, and that usually is indicative of retinal disease.
Okay, so important to maintain good health.
Absolutely, absolutely. And not only that, keep your appointments with your medical professional that is helping you follow your progress with your diabetes and your high blood pressure. Don't just think that your medicine is continually working because you can become tolerant to it.
Okay, good advice. Seems allergy season is upon us every year, and I think now people are subject to grass cuttings and experience dry, itchy, irritated eyes.
Quite common.
Yes. Any advice on treating this?
Well, at home, what you can do is a cold compress, or if you have some artificial teardrops, if you put those in the refrigerator and you put those in cold, that feels wonderful. But if you're absolutely certain that you do have allergic response, you can use over-the-counter allergy eye drops. Opcon A is one of my favorites. Zyrtec allergy drops, one of my favorites. But there are some that are prescription as well that you can get from your eye professional that are a bit stronger and truly do help diminish those symptoms and even prevent if it's used on a regular basis during allergy season.
Okay. And just like we use skin protectant when we're out against the sun, protecting our skin, what about our eyes? Is there anything we can do?
Absolutely. Again, we talked about the blue light, and ultraviolet light is very damaging to the eye. When you buy a set of sunglasses, just make sure that on the label that it says that it protects 100% of UVA and UVB. If it doesn't say that, don't purchase them. All of the known brand names such as Ray-Ban, Oakley, these types of sunglasses, they all correct for that 100%.
Okay. Dr. Alverson, very good information this morning. And if we have employees who'd like to know more, they have questions, how can they contact you?
Well, my practice is Eye Care Associates of Southside, and the phone number is 256-442-6200.
Okay. Well, we thank you so much for stopping by. You drove quite a distance this morning to be with us, and thank you again.
Okay.